At the heart, we promote mental wellness, and we do that through prevention, education, and advocacy. And we bring access to care around those recovery and support services. And we do this through public health reform and advocating not only at the local and state level, but also on the federal level. So we can be considered as a point of entry into services for individuals needing care around their poor mental health. It's not just the individual that is in need calling us or reaching out for services, but it's also caregivers and parents, individuals taking care of their elderly parents, healthcare workers, supervisors, workplaces. How do we support not only the individuals and friends that we love, but how do we also support the systems that we oversee in regards to leadership? Since the start of COVID, we have seen a 300% increase in the need for our essential services through Mental Health America. Our online screening tool had seen an increase of 500% between September and October of 2020, with youth 17 years of age and younger looking for support and resources. We really don't know what the long-term effects of mental health is going to look like from this. We do know that through a recent Gallup poll that mental health has been the lowest that it has been in the last 20 years in our country. When I speak about this, I always say we are preparing for the next pandemic. We know that 75% of poor mental health signs and symptoms show before the age of 14. So it's really important to have these conversations with parents on what to recognize and how to get their children into care early on. One individual that I actually worked with is a mother in our community, and her daughter was showing poor mental health, and she reached out to us looking for resources around a local therapist, and we were able to connect her with a therapist. But over a couple of months, her daughter was not showing improvement, and the decision was made to move her into an inpatient clinic. But at that time, we didn't have beds opened up here. So this family member had to make a decision of where their daughter was going to go for inpatient. We were able to help navigate through education of what the surrounding inpatient clinics look like, what their offerings were, drive times, visitation, all of that. That's a hard system to navigate. Her daughter successfully went into inpatient, and this mother has continued to work with us. When her daughter was ready to leave inpatient, she needed wraparound services and continuum of care for her daughter. Just because you're working with a clinic or a therapist, it doesn't mean that you're going to get the holistic view of what all of those services are going to look like when you come out. But Mental Health America does provide all of that information and education of what that will look like. United Way funding allows us to build upon, with other funds, our programming around information and assistance, our mindfulness programming within the schools. So over 900 students, because of United Way funding and other funders, we have been able to provide that curriculum in our schools, not only to those 900 students, but also to those teachers and support staff, workplaces and community. United Way funds all of that education to our community to be able to provide that mental health education around suicide awareness and poor mental health signs and symptoms, and our suicide prevention trainings for question, persuade, refer, QPR. Mental Health America is so appreciative to every single person that donates to the United Way. We cannot do this work without our community members making those donations. You make this work possible. We are a small team of 5 individuals, but we are lifted every single day by every single person that donates to the United Way. MHA Ambassador Program will be starting in 2021, and our Ambassador Program are individuals that have lived experience around mental health. And that could be someone who has lost a child to suicide. It could be someone who has recovered from a mental illness. It could be someone who wants to shift the culture of mental health within their workplace. It can be utilized within the avenue that the individual has an interest to bring awareness around our mental wellness. And it's really putting on that badge to say that I represent mental health within our community and I want to bring forth this story. We also have support groups, and they have grown a lot over COVID. This year, in 2021, we are expanding out to our widows support group, a grief support group, and a chronic pain support group. If you're looking to get involved with Mental Health America, you can give us a call at our number that'll be on the screen, or reach out to us through our website at mhasheboygan.org. And you can speak to anyone who answers the phone, and you can shoot us an email also at our info@mhasheboygan.org. We welcome all ideas, and we look forward to working with anyone that comes to us in bringing awareness around our mental health in our community.